For my public health issue, I'm doing the rise of opioid abuse. During this presentation, I want to cover what it is, the history of addiction, data and facts, risk factors, and a solution to it. First, I'm going to start off with what are opioids, for those who are unsure. I have opioids are a broad group of pain-relieving drugs that work by interacting with opioid receptors in your cells. Two common ones are fentanyl and heroin that we are seeing an issue in. Fentanyl is a potent synthetic opioid, and then heroin is also an opioid drug made from morphine, a natural substance taken from seed pod of the various opium poppy plants. Next year, I have a video clip that kind of shows the reality of someone who might be dealing with opioid addiction. I think it's important to see what really goes on behind the scenes.
The face of addiction is changing. What once seemed relegated to desperate souls hiding in the shadows now impacts our friends, families, and co-workers. More people are addicted to opioid painkillers than ever before.
I believe that over the past 20 years, definitely, the indications and the setting in which opioids are provided has changed dramatically.
Mayo Clinic pain management specialist Dr. Michael Hooten says that's good and bad. People are able to get relief from severe pain, but they're also able to get prescriptions for opioids when less addictive options, such as ibuprofen, may work just as well.
If they are predisposed to develop addiction, either neurobiologically or from a behavioral perspective, then all of a sudden we are selecting this group of individuals who may go on to have long-term problems.
Dr. Hooten says educating people about the dangers of opioid misuse may be an important step in managing this public health crisis. For the Mayo Clinic News Network, I'm Vivian Williams.
And then also from the video, or just a point in general, I think it's to take away that not only is opioid addictions hurting the people, it's hurting families as well. I wanted to also include an area that was hit hard with opioid addiction, which is Ohio in general, the state. It is among the top 5 states with the highest rates of opioid-related overdose deaths. I have in 2016, there were 3,613 opioid-related overdose deaths in Ohio, and a rate of 32.9 deaths per 100,000 persons, and more than double the national rate of 13.3 deaths per 100,000. And since 2010, the rate has tripled from 10 deaths per 100,000. And in the same period, the number of heroin-related deaths increased from 355 to 1,478 deaths. And deaths related to synthetic opioids rose from 175 to 2,296 deaths, which is a very spike in deaths. Also here I have a chart that just shows the U.S. average and then Ohio, which you can see a very drastic increase in 2011 to 2016. And then here's another one, also has the total number of deaths and then the years as it progresses. So it does spike up definitely between 2013 and 2016. There's a high increase in the total. And then I also want to include the history of opioid addiction. Like, how did this all become? How did it start? So there's like 3 different waves of how it. The first one is in the early 1990s. I have in the beginning of the early 1990s when deaths involving opioids began to rise after a sharp increase in the prescribing of opioids and opioid combination medications. For the treatment of pain, the increase in opioid prescriptions was influenced by reinsurance from pharmaceutical companies to prescribers, claiming that the risk of addiction to prescription opioids was very low. And I have also during this time, pharmaceutical companies also began to promote the use of opioids in patients with non-cancer related pain, even though there was a lack of data regarding the risk and benefits of these patients. Then, fast forwarding to 1999, 86% of patients using opioids were using them for non-cancer pain. It was found that the communities where opioids were readily available and prescribed liberally were the first places to experience increased opioid abuse and diversion. So you can see that opioids were mainly to those suffering from cancer, but as time has gone, it has been extended to people that didn't have cancer. As continuing to 2010, there was a rapid increase in deaths from heroin abuse. As prescribers tried to decrease prescribing opioids, once that came into effect, the focus turned to heroin, a cheap, widely available, and potent illegal opioid. The use of heroin increased in both male and female, making the heroin-related overdose increase by 286% from 2002 to 2013, and approximately 80% of heroin users admitted to misusing prescription opioids before turning to heroin. Also, heroin is commonly injected, which puts users at risk for infections-related disease like HIV and AIDS, hepatitis B and C, skin infections, bloodstream infections, and infections of the heart. Continuing, moving 2013, then became an increase in deaths related to synthetic opioids like fentanyl. The sharpest rise in drug-related deaths occurred in 2016, with over 20,000 deaths from fentanyl and related drugs. The increase in fentanyl deaths have been linked to illegally manufactured fentanyl, not derived medical fentanyl, used to replace or alterate other drugs of abuse. Here, I'm on to my next bullet point. I wanted to talk about data and facts of opioid abuse, and here are just random facts. I have roughly 21 to 29% of patients prescribed opioids for chronic pain misuse them. Between 8 and 12% developed an opioid use disorder. An estimated 4 to 6% who misuse prescription opioids transition to heroin. About 80% of people who use heroin first misuse prescription opioids. Opioid overdose increased 30% from July 2016 through September 2017 in 52 areas in 45 states. The Midwestern region saw opioid overdoses increase 70% from July 2016 through September 2017. I also have opioid overdoses in large cities increased by 54% to 16 states. Every day, more than 115 people in the United States die after overdosing on opioids. And in here, it also has just more facts that I thought were interesting that I found on a website. One that I'll just point out is 130 plus people die every day from opioid-related drug overdoses, and then also 11.4 million people misuse prescription opioids. Another bullet point is risk factors with rise of opioid abuse. Since these drugs are being injected, there has been increased rates of HIV/AIDS, and also hepatitis B and C. Countries experiencing increased rates of neonatal syndrome, which is newborns with withdrawal symptoms because their pregnant mothers have been misusing during their pregnancy. Options for patients to access the support and service needed to recovery remain limited, even for those with health insurance. I also want to include the effects. So short-term effects of opioid abuse vary, but they often include erratic feelings, paranoia, nausea, drowsiness, pain relief, and then also opioid abuse has very serious long-term effects as well, including heart infections, liver damage, brain damage as a result of respiratory depression, a severe reduction in the number of breaths taken per minute. Next comes the solution to solving the public health issue. I think the first step to solving this issue is prevention, and with prevention, I think it's education. I have talking about the issue and having more people become aware of opioid abuse. I think acknowledging people that if you are prescribed a pain reliever, like a strong one, knowing the risk factors that come along with it, and having that prescriber or doctor notify, like tell them that this could be something that could occur. Also, knowing the warning signs. If you or someone you know could become addicted, and to stop it before it could become worse. Also, I have knowing the resources that are able to help someone who is addicted or finding help for yourself. I think also an issue is not knowing what's out there, not knowing where you can get help. And then also I have knowing the causes that lead someone to become addicted. And also with prevention, my next would be intervention and treatment. Having successful treatment centers, funding for the centers, medication to help with withdrawal and lower relapse rates. Because I think that's also an issue is having those treatment centers, staying there for a few months and then coming out and relapsing and going right back to the issue. So I think I bulleted having a successful treatment center so people were able to recover and live with the struggle of wanting to relapse but staying through it or taking care of yourself. And then also, kind of relating back to what I said, is not relapsing, the aftercare, continuing with treatment. And I think an important part of aftercare or solution that I believe in is relocating. I know a lot of people, they get back from the treatment and they go back into the same home, the same space. I think relocating might be a solution, like finding, I guess that is hard to find a new place where you live, but relocating, trying to start fresh, I think is an important step to solving opioid addiction. And then that concludes the end of my presentation. Um, I hope everyone learned something from this, and let me know your feedback on how you might want to solve opioid addiction.